The topic of this video is how to self-administer Ipratropium Bromide nasal spray to help manage sialorrhea, also known as hypersalivation or drooling. Sialorrhea can be a bothersome side effect of some medications, including clozapine. It's important to note that the use of Ipratropium Bromide nasal spray in this manner should only be done under the guidance and prescription of a healthcare professional. Although sometimes Ipratropium nasal spray is used in the nose for the purpose of helping people with sialorrhea or excess saliva production, Ipratropium is sprayed under the tongue. Before we get started on the demonstration, here is an important reminder. This video discusses off-label use of particular medications. These off-label uses have not necessarily been proven to be safe or effective for the indications discussed, and are not approved for such uses by the Food and Drug Administration. This content is presented for informational purposes only, and is not intended to endorse or promote use of these or any other medications. Off-label use of any medication is a clinical decision that must be made by a treating clinician in their professional judgment and with the patient's informed consent. APA provides the information in this video on an as-is basis and makes no warranty and assumes no responsibility regarding it. All individuals depicted in this video are actors, not real patients. The first step is to review prescription information. Check the number of sprays and frequency recommended by your doctor. Next, you should review the medication material. Refer to the enclosed information for specific preparation and administration instructions. You'll need to gather the following supplies: Ipratropium nasal spray, a small amount of water in a medicine cup, teaspoon, or any other container, and a clean, dry paper towel or tissue. The paper towel or tissue and small amount of water are optional. Next, ensure your hands are clean. Wash them thoroughly with soap and water, or use hand sanitizer if soap is not available. Sometimes it might help if you dry off the area under your tongue using a tissue or paper towel before administering the Ipratropium. This step is optional. Now let's proceed with administering the Ipratropium. Tilt your head slightly backward. Gently lift your tongue to create a small pocket underneath. Hold the Ipratropium bottle in one hand and bring it to your mouth. Press down on the nasal spray pump to release a single spray. Administer the prescribed number of sprays under your tongue. Be precise and avoid touching the bottle to your mouth. If you have trouble seeing what you are doing, try doing this in front of a mirror. Now wait about 30 seconds to allow the medication to be absorbed. After you allow the Ipratropium to sit for about 30 seconds, it may help to swish a very small amount of water in your mouth to help its absorption. We typically recommend about 5 milliliters, no more than a small teaspoon, of water. Swish about 5 milliliters, the amount in a teaspoon, around your mouth, and then spit it out. Finally, keep the Ipratropium out of reach of children and store it in a cool, dry place, away from direct sunlight. To ensure the effectiveness of Ipratropium nasal spray and your safety, avoid these common mistakes. Do not touch the bottle to your mouth to prevent contamination. Do not swallow the medication immediately or swish too early. Let it absorb under your tongue. Do not use more sprays than prescribed by your healthcare provider. Thanks for tuning in to this informational video on how to use Ipratropium Bromide nasal spray for sialorrhea.